Hi everyone, welcome to our first webinar here. This is really exciting. Thank you all for joining us. My name is Dr. Alex Volchonok, and Dr. Susan Marra is here as well. We'll give probably maybe another like minute or two for people to fill in. But I couldn't say thank you enough to Dr. Marra for putting this together and spearheading this initiative. We have so many great people, patients on the East Coast, West Coast, from all over the world joining us here. So this is really exciting.
So let's wait 2 minutes, okay?
Yeah.
So that everybody can get here and then we're going to start. But in the meantime, what I wanted to say to people is I met Alex on the GLA board. He was a guest speaker, and I just really resonated with what he said. And so he and I had a Zoom and we decided to collaborate. And ever since then, we've been collaborating. I've been sending him patients, and he's finding all kinds of things in the oral cavity and the oral microbiome that seem to be uh, diseased or dysfunctional. And that are, I don't know if they're directly related to Lyme, but I suspect they are. And Bartonella too. Bartonella loves the oral cavity. So all right. So one more minute and then we'll get started. We're hoping to have the webinars the second Thursday of every month at 2 o'clock East Coast time and 5 o'clock West Coast time. And we're going to start with the
All
very
right, sorry,
basic.
flip that. Five o'clock East Coast,
I mean,
two
five
o'clock
o'clock
West
East
Coast.
Coast. Yeah. And we're going to start with the very basics, and we're going to just keep building. And then at the end, all during the while, you can put your questions in the chat, and then there's going to be plenty of time for you to ask questions that Dr. Volchonok can answer. So let's start. Let me introduce him. I'm so excited. He's, excuse me, my new friend. His name is Alex Volchonok, and he is a board certified periodontic dentist as well as an implantologist. He has offices in both New York City on, is it Park Avenue, Fifth Avenue?
Fifth Avenue, Fifth Avenue.
Fifth Avenue, and also one in Greenwich. And he comes with quite a pedigree. He did his bachelor's of science in molecular biology at Lehigh University in 3 years, and he did a research study on neuroplasticity and neuroregeneration in zebra finch brains. Then he attended the University of Pennsylvania School of Dentistry, where he graduated with a traditional dental degree, Doctor of DMD. And then he did a residency at Columbia University and periodontics in implantology. And all along the way, this man has more awards than I have letters in my name. He graduated top of his class. He received many scholarships. He's really put himself. He's really put the work in. And what's super cool is that he is the only biological dentist that is a periodontist in the United States. And he just recently completed a periodontic sort of sub residency at Tufts University in January to June of 2025. It's the first program of its kind. I mean, this guy is cutting edge. So we're really, really happy to have him here talking to us about what we see, the pathologies of what we see in tick-borne illness. And I'm going to turn it over to Alex. And please put your questions in the chat group.
Perfect, perfect. Dr. Mara, thank you so much for the wonderful introduction and everyone for your attention and attendance to this. I'm excited to have a chance to present some of the oral health factors that I think are important for everyone to know about, and also to engage in question and answer and make this a dialogue both ways. So, let's get started here. I will kind of share the presentation here. I will just quickly ask to check in that want to know that everything's looking good. Do we kind of see it in full view here, Dr. Marra, do we see you well?
Everything looks good.
Everything looks good. All right, excellent, excellent. All right, so the topic that we'll talk about, today is oral systemic health in Lyme disease and chronic illness. I think this is a very important conversation, important topic, as Dr. Mars shared. We've engaged in our own dialogues about this because we feel that there's so many patients that these issues transcend, and the oral health component is really important to bring into the mix of this. In fact, the former U.S. Surgeon General had a statement that you are not healthy without good oral health. And so that's an important concept to understand that I feel like oftentimes may be overlooked. And so, the fact that everyone is here and everyone is willing to listen to this is a testament to just how important all this is. Dr. Mar did a great job of introducing me, so I'm going to kind of skip over this, but I have a great love of learning, and I'm always looking to be at the cutting edge of the science and the education, both here in the United States and throughout Europe. And I feel like that's what's brought me together to bring on a biologic concept to the way that I do practice. I also want to share that what I do is really not just work solo. I work with a wonderful team of biologically trained doctors and dental specialists. We cover everything from prosthetic work to airway treatments, TMJ, orthodontics, restorative work. So the patients that we see as a team, and that is what the concept of our practice is about bringing all these things together. So, what is the connection here? And what I want to think about when I think about oral health and I think about dentistry and medicine, I feel that there's a rift, that there's a split. And, while functional medicine has done a great job, I would say compared to traditional medicine, at looking at the root causes of systemic diseases, our healthcare system still today has silos of care. It's fragmented care, and patients will see a provider for certain things and see another provider for others, and there's not a continuity in what's going on. And I think dentistry really truly sits at the sideline of this, and it is one of the key gateways, one of the key drivers to health that gets overlooked. And I believe that integrating biologic dentistry with functional medicine will allow us to treat the patient as a whole and really get to the bottom of many, many chronic health diseases. What is biologic dentistry? It's a philosophy of care. So, the first and foremost aspect is that it builds on the concepts of evidence-based traditional medicine and goes a step further to see how we can incorporate this in a holistic mindset where we take a look at the root causes of the disease and treat the body not just at the level of the mouth, but as a whole. We also want to identify and resolve inflammatory drivers with minimally invasive protocols and approaches. We want to do the least amount of harm possible. We also focus on the biomaterials that are used, especially in dentistry. We know that the biomaterials that we are placing in patients' bodies are to be there for a long time. So we want compatibility. We want to minimize toxicity. And also, we want to support regenerative protocols. And if surgery is necessary, we want to focus not just on resecting or removing something, think like a tumor, eliminating that. We want to instead restore the normal form and function of the body. So, this is the four cornerstone philosophies of biologic dentistry. And the mouth is this gateway, it's this entryway. Think about it. Every day we eat through our mouth, we speak through our mouth, we express ourselves, we breathe, we do so much that starts right at this gateway. And the mouth is a place where we have many, many bacteria, and these bacteria have a commensal and pathogenic interaction with our body, and this is moderated by our immune system. So what I mean by this is that the environment of the mouth affects whether we are shifting towards health or towards disease. When things are healthy, when we have a healthy bacterial flora, this promotes homeostasis or balance in the body. And when we have disease or dysbiosis, then we see a shift in the type of bacteria that are there. And this creates chronic inflammatory diseases, not just in the mouth, but throughout the entire body by elevating inflammatory markers and even allowing dental pathogens, gum bacteria, to enter into the body through the bloodstream through the concepts of things like leaky gums, if the integrity of the gum tissue is not ideal, and this disease can go beyond the mouth. When things are healthy, we have over 700 species of bacteria that are endogenous, indigenous to the mouth. This is what we would normally see. It is even normal to have fungi species in the mouth, archaea species in the mouth. In health, this is all balanced. And it's actually one of the most metabolically active microbiomes, meaning that the interactions are happening on a much greater scale than even what we see sometimes in the gut. And oral bacteria play a critical role in many, many functions. In fact, without oral bacteria, without healthy oral bacteria, we would not be able to digest or even survive for that matter. Teeth also play a role in this. So when we have healthy teeth, there's vital structures within that tooth that incorporate an artery, a vein, and nerves. There's a blood supply to our teeth. There's a life force to our teeth. There's a feeling component to our teeth that directly wires into our brains. And so when we have a healthy situation with the tooth provides more than just chewing function. It provides proprioceptive feeling, meaning that we know what we're chewing. It gives us feedback. It gives us stability and balance to our jaw joints. And even some research has showed that it's the development of teeth that have allowed us to develop upright posture and gait. And the nerve tissues of the tooth are connected to the brain. So when we have disease in these structures, it can travel and transcend and affect other parts of the body as well. The gums are the front line. The gums are the first line of defense in the body. The microbiome of the mouth has a very delicate interplay right in these junctions between the teeth and the gums, which we call the pockets. And there are many factors, both intrinsic and extrinsic, that can affect that. It can be affected by your diet, by your systemic health. It can be affected by certain supplements or medications that you take. It can be affected by water intake and hydration. And our gums are always trying to protect us. There is saliva present in there. There's gingival curricular fluid. There's a flow of fluid in the area. Our immune system is active in this area in generating antibodies and immune cells that help keep pathogenic bacteria at bay and prevent it from entering our bodies. When there is disease, when there's chronic inflammation and chronic disease, if you look at the image to the right, you'll see that the gum starts to pull away from the tooth, and this tartar and this plaque starts to build up, and this biofilm becomes toxic. And there's damage to the gum, and there's even damage to the bone. But this allows the bacteria to enter into the body and it can start to create chronic dysregulation of other organ systems. Anything from the brain in its link with Alzheimer's disease to the gut to the heart and many, many other chronic disease situations as well. What exactly happens when we talk about a dysbiosis of oral disease? What happens between a healthy mouth and a diseased mouth? Well, there's actually this shift that happens, and the bacteria starts to change in terms of its makeup. And it goes into this classification. In the 80s, we've classified oral bacteria based on certain colors. Yellow, green bacteria more conducive with health, orange and red bacteria more conducive with disease. And we see that there's this shift that happens. When there's poor hygiene, when there's poor systemic health, when there's chronic illnesses or diseases, the oral microbiome of the mouth makes a shift as well. And we start to see that the bacteria makeup moves to a different direction. It's almost like you have a neighborhood and all the good people have moved out, and now you have some not so savory characters moving in. And that kind of shifts the environment towards disease. Some of these trends is that there's a decreased number of protective bacteria. There's a greater number of pro-inflammatory bacteria. The environment loses its oxygen affinity and oxygen concentration, which means it's a more anaerobic environment, which is typically associated with more diseased bacteria. It loses its diversity. The bacteria becomes more concentrated in pathogens, and we start to see inflammatory markers and in that innate and adaptive immunity start to activate. And these are some of the ways that we start to see oral inflammation increase. And if it's not controlled at that point, it also starts to now move into systemic inflammation as well. Some of the ways that we see this is in a disease called periodontal disease. So, as a periodontist, this is one of the key issues that I treat with patients. So, periodontal disease is an infectious disease, meaning bacteria that has gotten into the gum and into the pockets starts to create inflammation and attacks the supportive structures of the teeth. It activates our immune system to create bone and gum breakdown, which we call attachment loss, and the pockets around the teeth start getting deeper. We start to see gums recede, and ultimately, if untreated, we'll see tooth loss. And this illustration here on the left side of the screen shows those stages of progression of disease from a healthy mouth to one that has gingivitis, meaning bleeding gums and inflammation of the gum, but no bone loss, to the next three stages of periodontal disease, where you can see the severity of disease of recession, bone loss, and even tooth movement and tooth loss starts to take place. And these factors are modified not just by the bacteria in the mouth, but also by a patient's genetic makeup and also social behaviors. For example, alcohol consumption or tobacco smoking. These things will also play a significant role in this disease process. And so we see this shift, right? When the oral microbiome starts shifting towards dysbiosis, we first see dental and periodontal infections that fester. If the gum starts to break down, we start to develop a leaky gum situation and the bacteria starts to invade. This moves on to systemic inflammation. And this bacteria can travel through the bloodstream, through the respiratory tract, through the GI systems, to other organ systems, activating inflammatory immune responses and triggering other forms of disease. And this is not a rare disease. Almost one in every two people has some level of periodontal disease. Risks increase with age, and also level of severity can vary between different individuals, even with the same microbiome. So it's so important to take a look at the genetic makeup and the behaviors and habits of each individual patient. But we now know through many, many, many studies that periodontal disease has a significant implication on other health diseases. Almost 95% of patients who have periodontal disease will also have signs of diabetes, 70% Alzheimer's disease, 50% have an increased risk for heart attack and stroke, directly triggered by oral bacteria, creating plaques in the heart or invading the blood, the valves within the heart, and even cancers, which can be triggered by dysbiotic bacteria in the mouth. Disease is not limited just to the gums, however. Disease can also be associated with teeth. We talked about the healthy structures of a tooth, but when there is decay or bacteria that builds up in the teeth, it starts to form a cavity. If that cavity progresses down into the pulp of the tooth, that vital blood supply can be lost and the tooth can die. We call this a necrotic tooth. It can sometimes happen in a way where there's a very acute condition, where it's inflamed and there's a lot of pain. And sometimes it can happen slowly over time, and a patient may not even know that they have this issue. But the type of bacteria that can build up within the root canal, especially if that area has been allowed time to fester and brew, is extremely pathogenic bacteria. And and those pathogens are protected from the immune system because they're contained within the tooth. And the body does not have a way to bring immune cells to that area. Usually dental abscesses, and this is an important thing for patients to know, Usually, dental abscesses initially go unnoticed. By the time we see them on a traditional two-dimensional X-ray, they may have been there for at least 6 months to a year, and there is already signs of significant bone loss. So early detection and evaluation is very critical. And dental diseases, dental abscess of the tooth, don't just affect the bone locally, where we'll see bone loss, inflammation, and gum infection. It also triggers systemic responses, activating cytokines, interleukins, and all these cell signaling markers that activate inflammation throughout the body as a whole. And there is tremendous evidence that talks about the effect that infected teeth can have on cardiovascular disease, diabetes, chronic kidney disease, pregnancy outcomes, and even autoimmune disorders. Another important condition that we're learning more and more about, especially because we have much better diagnostic tools now, is cavitational osteonecrosis. This is a big word that really refers to a hole in the bone, a cavity in the bone. And this is a result of incomplete healing following an infection or an injury to the jawbone. And the most common dental procedures that create a cavitation is when a wisdom tooth is removed and the tissues like the periodontal ligament or the follicle that houses the tooth is not fully cleaned out. We see this happen a lot because wisdom teeth tend to be removed quickly and without the attention that that site needs to have opportune healing as well. But it also can happen from the extraction of even any other tooth, especially if there's complications like a dry socket. Failing root canal teeth, meaning teeth that have been treated or root canaled, these teeth will not have symptoms. There's no nerve left in the tooth to inform you that something's going on. And usually the pathogens in this area are much more toxic, and this can create an infection in the bone that is very hard to remove or eliminate if it's not treated properly. And these infections and necrotic teeth with periapical pathologies can manifest as cavitations. And if you look at the X-ray on the right, you can see underneath the roots of the tooth this shadowing, this dark area. Sometimes when the tooth is removed, if this area is not cleaned out as well, this can lead to a residual cavitation or a residual hole within the bone that can create disease. In the image I have on the right, I have a 3D scan that shows a wisdom tooth that has been removed about 20 years ago for this patient, and we can see this well-demarcated void. You can see where the bone marrow just abruptly stops, and we see this dark black area. And these characteristics, what we find in these areas is that there's a poor blood supply, right? Meaning that there's limited immune surveillance. This is a very opportunistic area for pathogens such as Lyme bacteria, spirochetes, fungi, mold. All these things can really harbor there. It's also an anaerobic environment, which is conducive to pathogenic bacteria. There's also been evidence, and now we do new studies where we can take a look at the actual cytokines and inflammatory markers that are produced in these areas, and we find that there's a very high concentration of inflammatory mediators. In my mind, I think of this as almost like a homing beacon that's stuck within your jaw, emitting signals of inflammation and infection. And the reality is, patients don't feel this, they don't know about this. They're asymptomatic, they're silent issues, and you could be walking around decades with this in your jaw, which creates disease. And these are chronic inflammatory signals. They contribute to fatigue, brain fog, autonomic dysfunction, autoimmune conditions, and even treatment resistance. Think about patients who have Lyme disease who are just not recovering from the therapies that they're doing. So this is an important thing to look at. And I think of the mouth when there is disease, this is a pathogen reservoir. The oral environment offers several advantages to these persistent pathogens. When there's a low oxygen anaerobic environment, whether it's in the periodontal pocket or the jawbone, this is very, very conducive to a lot of bad bugs finding refuge. The biofilm in disease protects these pathogens from treatments like antibiotic therapies, and it's very difficult for your own immune system to attack it. So what we've learned through periodontal disease is it's absolutely critical to break up the biofilm for therapies to be effective. There's also very limited vascularity in diseased bone and cavitation sites. So the body, even if it wanted to try to treat the area, it doesn't have a way to bring immune cells to that site. And this constant immune signaling, this perpetual systemic inflammation, this homing beacon that I talk about, is a real significant issue, especially something that should be flagged in patients that are having a tough time healing from other chronic infection diseases. When we think about tick-borne diseases, there's other reservoir sites as well, such as joints or nervous tissues or connective tissues, that can be very hard for medications or treatments to get to. We should add the mouth into our thinking as one of those places that we need to help the body clear disease from. In the studies that I've researched and in my conversation with Dr. Marra, the numbers are staggering. Somewhere between 10 to 25% of patients that have Lyme disease and associated co-infections struggle to achieve sustained remission despite antimicrobial therapy. Even with the advances in treatments, some patients are not getting better, and a significant amount. This is thousands and thousands, tens of thousands of patients. And I think one of the key issues is the mouth is frequently overlooked. This can be a major source of persistent infection reservoirs. The mouth is a warm, wet environment that is ideal for pathogens to harbor in. Some of these pathogens, like Burgdorferi bacteria, love to harbor within cavitation sites in the jaw or within periodontal pockets within the mouth. And we see that. And we'll talk about in subsequent seminars. I'll talk a little bit about some of the testing that we do and some of the ways that we look for this. But I will say that we flag this very, very, very commonly. And most importantly, treating the oral drivers of disease can often unlock progress elsewhere in the body. So patients that feel like they're plateaued or they're stuck, this is one of the key areas that we need to look at. And let me explain a little bit of why I think antibiotics alone don't work. We've talked about that biofilm and how it protects the microbes from eradication. We also see that infected bone and periodontal pockets are poorly penetrated by antibiotics, and so they're not effective without having some other interventions and other treatments. And inflammation can continue even when the pathogen load is reduced. And so many patients will reach this certain point where there may be improvement, or even they'll start with antibiotic therapy and they're getting better, and then they relapse, or they can't get better past a certain point. And the mouth is such an important area to look at, especially when we see that there's an issue getting past a certain plateau. So for this first part, I'm going to conclude with some of the key things that I want to make the case for addressing oral health and making sure that oral health is part of the equation here. So first and foremost, when there's disease, the mouth is a reservoir for many, many pathogens. And this is going to be a key signaling point for chronic inflammation. And if it's untreated, it's going to serve also as a barrier to full recovery. Addressing oral disease is essential, and it's an important part in the integrated healthcare model, in the functional medicine model. If we can restore balance to the microbiome, we can allow the body to self-regulate. We can allow the body to heal itself, and we can allow patients to get their lives back. The mouth is not just where disease begins. It's also where healing can begin. And I really hope that that can be a concluding thought to everyone for this first part here, to bring attention that the mouth is an important part of the equation, not just for disease, but also for health and wellness. So with that, I want to say thank you for your attention for this part. And I want to see if there are any questions that I can answer, or perhaps even Dr. Marra and I go through for any patients that may have any thoughts about what we've heard so far. I will also share that in some upcoming seminars, we'll talk about diagnostic techniques of what we do to identify these issues. And I will also have in further seminars, what are some of the treatments we do for that? So if that's some of the questions, stay tuned. I had a 30-minute window to try to get as much as I can in, but I hope it's a good introduction and at least give you some idea of some of the basics. But thank you all very much for your attention.
I'll go ahead and read some of the questions that came through, but if anyone has any questions, this is the time to go ahead and drop them in the chat now. So that way I can go ahead and read them out loud and help Dr. Volchonok answer them. So the first question that came through was, maybe you'll get to this, but my question is, what's the difference between your treatment of periodontal disease and a non-biological dentist? And how does that look?
Yeah, great question. We will absolutely cover that and we'll talk about that in upcoming seminars. But I will speak to it in a way that kind of makes sense to what we've talked about in this first part. The conventional thinking about periodontal disease is that there are bad bugs in the mouth and we have to kill the bacteria. The reality is that we need to live in balance with the bacteria. We need to create homeostasis. In fact, we cannot live without it. And so there are so many products out there. For example, Listerine touts, kills 99.9% of germs in the mouth. The reality is it's killing 99.9% of good bacteria. And this is an issue, right? And so traditional periodontal therapy focuses very heavily on using antibiotic treatments that will affect the bacteria in a disproportionate way. In fact, oftentimes the pathogenic bacteria may not even be treated effectively enough. It'll only affect and shift the microbiome for a short period of time, but then disease will remit. Another important aspect is the importance of foundational and supportive care in an ongoing basis. We need to establish a balance with our microbiome, a balance with our bacteria, and that's a really fundamental aspect that we need to think about as a shift in the approach. Stay tuned. We'll have upcoming seminars as we talk about specific treatments. But I think in biologic dentistry, the key is that we want to not only treat disease, but we want to also help the body restore health and balance. That's the key difference.
The next question is kind of a little story. I had Lyme and I'm sorry, it's cutting off here. Let me just see. I had Lyme and Babesia for 14 years, may still have it. Dental issues started 3 years in. This triggered major disease, including autoimmune disorders, dysautonomia. Sorry, I'm not a great reader on these long words you're giving me. POTS and MECFS. I had HEDS and MCAS and suspected Sjogren's. I'm about to lose all of my teeth at 46 due to severe periodontal disease. I believe my mouth is a huge driver of my chronic illness. I have severe infection right now on a third round of amoxicillin. I have been having heart problems. Now it seems that possibly dormant Sjogren's is now very expressed. My eyes have been affected for months, painful, blurry, and I was just wondering about diabetes this morning due to excessive thirst and weight loss. My mother is a type 1. So I think it was just sharing kind of her aspect and what, she's relating to with all of this information here. Thank you so much for sharing.
Yeah, yeah. Thank you for sharing your story and the journey you've gone through. You're very much not alone because there are so many people that deal with these kind of things. And I'm glad that you're a part of this and you're working with Dr. Marra and you're interested in educating yourself on the dental health aspects. The only thing I can say is that if you are at a what we'll call like a terminal dentition point where we're talking about either the teeth need to be removed and replaced, it is very important to make sure that there is a healthy oral environment established before the placement of dental implants. I can't stress that enough, how many times I see dental implants placed in diseased sites only to have significant disease return shortly after, 1 or 2 years after. So happy to talk more about that, but just wanted to throw a quick pearl of advice out there.
The next question is, where does Borrelia live in the mouth?
Yeah, it can live in a lot of places. So some of the places that we can pick it up is in those pockets. So that space in the between the gum and the tooth, especially when there's periodontal disease, that environment becomes inflammatory, anaerobic, and it's an ideal site for this pathogen to exist. It can also be found in areas where there are dental infection, or for example, if a tooth had to be removed and the site hasn't been cleaned and that bacteria has been present in the mouth, it can fester in that site and it can be part of the milieu of bacteria and pathogens we will see in a cavitation area. So that is some of the key places that we will find it. But it will exist. It will exist in the mouth, and sometimes it could be in an active state and sometimes in a dormant state.
The next question kind of adds similar. Can Borrelia hide out in the connective tissue in the tooth roots, or is it usually a different type of bacteria? Any recommendations for managing biofilm during extraction? And is it possible to have a reoccurrence of Lyme, or are we looking at staph or candida?
Um, so to the first part, yes, it can exist within the connective tissues, and that's one of the key areas that we will find it. The periodontal ligament is a connective tissue that we find. It's kind of the technical term for the pocket or the area right above the pocket. So yes, we will find it there. Techniques to mitigate that is that there are certain surgical protocols, and we will talk about it. I'm going to dub it a biologic extraction technique, and I'm going to really talk about that in upcoming seminars because it is very, very important to take time to clean these sites. One of my mentors has always shared with me is that the surgery begins once the tooth is out. And that's a very contrary thinking to most dental surgeons, right? Where they think once the tooth is out, the work is done. It's because once the tooth is out, there is so much infection and inflammatory mediators that must be cleaned from that site if we want to give the body a chance to heal.
The next question is, does Borrelia drive into the tooth?
So I haven't come across any direct evidence that it drives into the tooth. I think the mechanism would be a little bit more of like a carrier, meaning that other bacteria and other pathogens kind of create the environment that allows that to happen. So for example, bacteria that causes dental decay emits an acid. The acid then erodes the tooth structure, creating a cavity within the tooth. If that hole opens, other bacteria and other pathogens can get in there as well. And so we see that with dental situations. We can see that with the gum. We can see that also with the bone.
Can we do Borrelia PCR in the gums and teeth? And what's the best way to degrade the biofilm in the mouth?
Yes, so there is some testing. That I think will be probably our very next webinar. We're gonna talk about some of the screening and testing for this. So I'm gonna come up kind of just ask you to stay tuned on that one because I think that is a really good piece of information to get. But yes, technology is there for us to be able to do that. And Kim, can you remember the second part of that
Second
question?
part was, what is the best way to degrade the biofilm in the mouth?
Okay, excellent. So I want to change the thinking there. We do not want to degrade the biofilm. We want to create a healthy biofilm or support a healthy biofilm if it's existing. So this can entail utilizing a proper home care hygiene routine. We'll talk about specific products and specific techniques, in upcoming webinars. We also want to make sure that there's proper oversight, professional oversight, maintenance by a biologically trained dental hygienist that can take a deep dive and make sure that the teeth and the gums are healthy. It's also very important to have the proper nutrition, the proper hydration, right? This is a multifactorial process, and we need to make sure that if there are other systemic health factors that are uncontrolled, for example, like uncontrolled diabetes, or uncontrolled sugar, blood pressure, these things can all factor into the health of the mouth as well. It's a two-way street.
The next question is, as an advocate, we have a lot of questions about root canals that they ask if they should avoid them.
Yeah, we actually have a great webinar that we did recently about that. About a month ago, I talked about it. I'd be happy to share that with you. There is a growing amount of research, and I tried to put a little dabbling of that into this presentation that talks about the toxicity of what happens when there is a dental infection and dental abscesses. Dental infections, especially around root canal teeth, can be extremely toxic because there is no immune system present within the tooth to kind of even control or combat the growth of bacteria. We usually see a much more pathogenic strain and much more inflammatory pathogens in those sites. And they can get access directly to the body through the bloodstream, whether it's through the arteries that provide blood supply to the jawbones or through the gums themselves. So these can be really, really important areas to look at. And unfortunately, there's not a lot of symptoms as a patient that you would feel. We really kind of rely on our dental colleagues, our healthcare colleagues to help find this for us. And I think there's a little bit of a deficit in terms of standard of care in traditional dentistry, which really just advocates for looking at teeth in two-dimensional x-rays. And there is so much disease that gets missed as a result of that. So we'll talk about that. But yes, root canals, there is a lot of important information about that needs to be understood because there can be a lot of toxicity associated with that.
A follow-up question to that after, root canals is what do you think of dental implants?
Yeah, so dental implants are a device to replace a lost tooth. And if if that site or if that area that we're placing that dental implant into is unhealthy, whether that's because there is a cavitation in that site, meaning like a hole in the bone with residual infection there, or there's periodontal disease or inflammation in the mouth, or there's other systemic health factors that are affected, meaning like low bone density or severe osteoporosis or certain medications that patients even take, like certain antidepressant medications, bisphosphonate medications for bone density. There are many things that can affect the health and stability of a dental implant. But it is a very tried and true way to replace a missing tooth. There's about 75 years of research in dental implantology now. I think the exciting frontier in dental implantology is the success and the advent of ceramic dental implants. Ceramic dental implants are made out of a material called zirconia, which are metal free. This is excellent for patients that have immune sensitivities. These are excellent for patients that have had a lack of success with traditional titanium implants. And also, they don't have that same inflammatory profile and corrosive effect that you would see with a metal in the body over time. So they don't rust like a traditional metal implant would. So that is really a great frontier. And I think if you're someone who is looking at or considering dental implants, we'd be happy to talk a lot more about the benefits of zirconia dental implants. It's really kind of the future here.
Is it possible to build healthy gums if you have a genetic disposition for loose connective tissue like EDS?
Yes, it is possible, but it also is challenging. All right. So patients with EDS are going to be more susceptible to periodontal issues. Periodontal issues may not always be just bacteria building up in the pockets to create disease. It sometimes can also be gum recession and attachment loss in that sense as well. So there are a lot of other conditions that come up in the periodontal world that we didn't really talk about here, but it is really, really important. And I have a lot of patients with EDS that we focus on establishing good health protocols and good supportive regimens because if there is a breakdown in the connective tissue, meaning that the bacteria levels build up and they start to create a anaerobic environment that's conducive to periodontal disease, those patients will have a lot worse outcomes. So prevention is really, really key in EDS patients.
The next question is, how can you get Borrelia out of the oral cavity? Is it with ozone, red light, laser? What is it that removes Borrelia?
Yeah. So we'll definitely talk more about this, but a few things. There are definitely a lot of treatment protocols that need to be combined to be able to access and disrupt the biofilm and disrupt the sites where these pathogens can manifest, whether it's in the gums, whether it's in the jawbone, wherever that is. So usually there's some type of treatment that needs to gain access to those sites. So what doesn't work is things like just doing an ozone injection or ozone insufflation or something like that. It's just not enough. All right. These things burrow deep within the body, and we need a procedure, a treatment procedure to help us get there. With that said, I tend to find myself to be very humble when I talk about surgery because what I see my role as a surgeon is to help the body self-heal and self-correct. So if we are to do a procedure, we are really trying to optimize for your own immune system to be able to eradicate the pathogens. Even with using laser and using ozone and mechanical irrigations and debridements and all the things that we do in a treatment protocol, there's just no way to know that we got every single pathogen out. But what we do know is if we can create a blood supply to that area and we can boost your immune system and support your healing process, then whatever is left behind, your body can take care of. And that's the partnership, right? We need to partner with your body and your immune system to heal. And I see a lot of patients that sometimes get rushed into surgery or pushed into surgery when the body's not ready. And unfortunately, it usually does not work out as a result of that. So that's an important component here to think about. And I'd be happy to talk more about that in some of the upcoming seminars when we talk about treatment itself.
The next question is, how new is biodentistry, and where does biodentistry begin to deviate from traditional dentistry? I received a little tutorial. This kind of made me chuckle. I received a little tutorial from dentists, which essentially was biodentists have to pay higher malpractice insurance costs because of what they do.
Yeah, I think it's a bit of awareness. The concept of biologic dentistry that I wanted to present here and the way that I practice is a philosophy that I shared in one of those earlier slides. And I think it's a philosophy that any dentist would really agree with. The real question is how much additional training, knowledge, and interest does a dentist have to learn these things? And I'll kind of say it this way. I, in my background, my father's a gastroenterologist, so I kind of grew up in a medical family, in a medical household, and I always was fascinated with medicine, and I wanted to practice dentistry that was close to medicine. I also know a lot of dentists that don't like medicine, but like the artistry or the mechanical nature of dentistry. And they'll focus on that. And they will be wonderful dentists. I know many dentists who can do beautiful crowns or amazing preparations of the teeth or beautiful gum work, but are not thinking about it beyond the mouth. And I think to give a really clear answer is that it really should not be a deviation from standard of care. It should not be anything that raises your malpractice insurance. You should always practice ethically. You should practice appropriately. You should inform patients. And I think the key is really kind of getting to the root causes of diseases, using safe and non-toxic materials, and supporting the patient's own body and their immune system to heal, right? There's nothing that I think anyone would take qualm with that approach. The question is, would you take the time to train yourself in the techniques and the approaches to do that? And there's a lot of work that needs to be done in that because unfortunately, dental schools, traditional dental schools, don't give enough education about that, at least today. All right. But I am seeing that shift as well. And I'm happy to say that I think that's a thinking that will change over the next few years.
That was such a wonderful way to explain that. So that was nice. The next question is, what is the best toothpaste, mouthwash, and floss to use if you know that you have Lyme in the oral cavity?
Yeah. So in terms of best products, I can't say that I know of or seen any clear research that says one particular product stands alone in terms of its ability to help patients with Lyme. But what I will find is that there are several products or several groups of products that I think do really, really well. So, first and foremost, there are formularies of toothpaste that really help with inflammatory conditions and helping to support the microbiome. And to kind of shout out to a few of those, I think one product that's really great is Biocidin. All right. And so Biocidin is a natural based toothpaste that is capable not only in targeting anaerobic and disease bacteria and decreasing inflammation, but also supporting a healthy microbiome. But I'll kind of go a step further to say that part of the equation to this too is again, not just cleaning and eliminating disease, but also then supporting the formation of a healthy microbiome, whether that's through probiotic supplementation or even through proper nutrition and hydration. All right. And I'll even say other things like that. Stress and sleep, cortisol levels play a huge role in this too. So there's no one thing that you will do, no magic product that's on a shelf that will treat and address this. But the fact that you're thinking about it and that you're going to be using good products is definitely a part of the equation. And I'm happy to kind of create even a whole nother seminar on hygiene products, hygiene aids to really kind of talk about that too. I think we probably can go an easy 30 minutes to an hour on that alone.
The next question is a little bit of a backstory here. I've been living clinically with diagnosed Lyme, Babesia, Bartonella for 30 plus years. I don't have much organ damage in my organs, with the exception of my teeth. No matter how clean keep my mouth, I seem to get cavities. I also eat healthy, mostly whole grains, plant-based, all homemade due to food allergens, gluten, corn, soy. I now have 6 caps. 3 of them have root canals. I don't know how to brush my teeth well because of oral sensitivity, and my gums get sore when I floss. But I use a water pick 2 to 3 times a day. I clean the water pick at least once a month with vinegar and water, and I find the decline in my oral health very disheartening. I have dental insurance through a community Medicaid program, thus, what they cover is very little. I bought additional insurance, but it still doesn't cover much. I can't work, but I was denied, disability. Thus, getting the best dental care is not really an option for me. What can I do to prevent further oral issues? And just to add on, many years ago, I stopped using toothpaste with fluoride due to things that I read and heard about by alternative practitioners. Now I'm kind of doubting that decision and thinking of changing back. The water where I live is not treated with fluoride.
Mhm. Yeah, thanks for sharing that. I think I'll kind of try to break it down into a couple little like silos of advice. One of the things is kind of helping you focus on the things you already have and use. I think a water pick is a great tool to incorporate to help establish better health and hygiene of the gums. It's one of my favorite products when it comes to managing gum disease, and it's a product that everyone can do. It's affordable, it's easy to maintain, it's easy to have. So I really strongly would recommend that. From a toothpaste perspective, the mention of fluoride. Fluoride comes up in the conversation when there is, significant risk for dental decay, which seems to be kind of part of the story with the recent caps and things like that. But there has been a lot of advances in toothpaste technology. We talked a little bit about biocidin from an inflammatory perspective, but there is another product, for example, hydroxyapatite toothpaste, such as Risewell, for example, is another one that we advocate quite a lot. Hydroxyapatite helps the body remineralize teeth with their innate native mineral. So what I mean by that, teeth are made out of a crystalline structure called hydroxyapatite. When there is a decrease in the pH of the mouth, that crystalline structure breaks down, but our own saliva helps to rebuild that. Sometimes, though, that process may not happen effectively enough, and that's what leads to dental decay. Fluoride changes the mineral composition of teeth from hydroxyapatite to something called fluorapatite. Fluorapatite is a lot harder crystalline structure. It is more caries resistant. It's more preventative to get decay, but it also makes the teeth more brittle, which if there are other risks like clenching, grinding, or issues like that, or the presence of existing caps, this can lead to tooth breakage, which is also an issue. So we need to kind of look at that kind of really as a whole. But if there are things that you do to support it, I would recommend using the water pick. I would recommend using perhaps a hydroxyapatite toothpaste. And I'd also be really curious if you would talk with a nutritionist or have any research or access to that or resource for that, because sometimes the way that we eat, the types of foods that we eat, the frequency of the foods that we eat can affect the quality and quantity of our saliva, which is really the most important protective aspect to dental decay. So maybe that's something if there's a dentist in the area in the community you're in that you can kind of take a look at, or be happy to kind of, chat with you a little bit more about that as well.
That was a question. Should we use fluoride toothpaste? You pretty much covered that. And then how invasive is the surgery to fix a typical cavitation?
Yeah, so a cavitation surgery is an invasive surgery in the sense that we need to get through the gum and usually access the bone to get to that area. With that said, there are techniques we do, for example, utilizing a laser to access the bone that makes the process a lot less traumatic, more minimally invasive, and activate a better self-healing and self-repair process in the body. We'll talk more about that, absolutely, because I think that's a really important topic to get into. But I do want you to know it is a surgery, and it's very important to understand that there's really no other way to treat a cavitation, right? We need to get in there to do that. And I see Dr. Mara here kind of raising her hand here, and we're getting to the top of the hour here. So,
We
um,
actually finished all the questions.
oh, we did.
So,
Okay,
yeah,
great, great.
that was the last one. That was really a question there. So,
Yeah, wonderful, wonderful. Well, I mean, these questions have been really great, and honestly, it feels great to put this together for everyone and to know that there's been such value and such interest in this information. I will say, this is an exciting time for me as a dentist to kind of cross the pathway into the functional medicine world and talk with patients that are looking at that. And I commend you all for taking your time to educate yourself on this because I think it's so important. There are not enough people that know about this. There, unfortunately, are not enough doctors who know about this. But Dr. Mara is making incredible strides to help her patients with this, and I'm really excited to be partnering with her and trying to do my part to help patients throughout the world in terms of knowledge, understanding, and treatment approach. So thank you all for your time.
So for all of you guys that are my patients, thank you so much for coming to this webinar. And we plan on having one every month, the second Thursday at 2 o'clock Pacific time, 5 o'clock East Coast time. And it'll be different things like treatment for this. What should I do for this? It'll be, so the idea is that we're building on information. And that's why we gave you that big handout so that you can take notes and so that you can see how we're building. We're thinking about how we're going to do this. So this is a long-term project that Alex and I are working on. And Alex has put so much time into this for, for a newbie to this whole scene, this whole complex chronic illness scene. He's really done a great job, and I'm really happy to work with him. I feel really, really lucky, and you should too. He's the only biological dentist periodontist in the United States. It's a big deal, guys. Big. It's huge.
Thank you, Dr.
So
Marra. I really
just to
appreciate
add
you
on to that,
doing
someone did ask if we're going to be sharing the recording. So yes, we'll, once this is over, we'll save the recording, and Dr. Marra and Dr. Alex will be able to share it with you all.
So
Yeah,
Kim,
yeah,
can we
wonderful.
put it on our websites?
Yeah,
Okay, excellent. All right. So then
absolutely.
they'll be on my YouTube channel for sure, and they'll be on my website, and then Alex's as well. So you'll be able to go back. This was very foundational, and I intended it that way. I know it was maybe boring for some people, but even for me, I don't know all these things about teeth, and I want to know because I'm somebody who does have dental issues. A lot of you already know that. And I want to know from the get go, okay, what are we dealing with here? What's wrong? What's this? What are you doing? I want to know. And so inquiring minds want to know. So that's why I'm asking a lot of questions. And that's why I'm doing this is not only for you, but for myself as well. There's nowhere else, anywhere that you are going to get this kind of information anywhere. So I hope that you
Um,
appreciate that. And I hope that you enjoyed it. And I hope you have a wonderful evening.
the handout that Dr. Mara that you were referring to, I had a few questions come in the chat here that weren't able to see the handout that you mentioned. Is there a way you can share that with me, and I can, if anyone can email us at the office or email you
Oh,
directly for that handout?
the handout is what Alex made.
Oh,
Yeah, yeah, I'll pass that along and then we can
okay,
post that
wonderful.
as well.
And
Okay,
Yeah,
then,
there
that'd
was
be
a few
great.
people asking for it here,
yeah, and then
so.
people can take notes. It's really important. Like it's really important. It gives you like a foundational window into what we are doing here. We're not just willy-nilly like, oh yeah, let's just do no. No, we're systematically going through things so that you can get a really clear idea of how Lyme disease is affecting your oral microbiome and what are things that you can do to help yourself. Like I didn't even know what kind of toothpaste to use. That was my question, by the way.
I try to keep them anonymous.
Oh, it's okay. I'm totally fine with being completely clueless because look, if I'm clueless, then a lot of people are clueless because I take the time to read these kind of things. You know, I just don't know what to read until I met Alex, and he's like, "Oh, okay, well, here we go." So,
Yeah, yeah. Well, thank you all. I think this was a really great effort and great initiative, and I'm excited for us to to do more of this. This is
yeah,
really fantastic.
we're gonna delve into more serious and more in-depth things, and I think you're gonna learn a lot, and you're probably gonna know more than your dentist, and then that's a whole nother issue. All right, you guys, have a
Yeah.
good evening.
Thank you
Thank you so
all.
much
Thank you
for coming.
all.
Alex, Kim, thank you very much.
My pleasure. My pleasure.
All
Thank you
righty.
all. Everyone have a great rest of the day, great night, and we look forward to speaking more soon. Thank you.
Bye-bye.